Thanks to Matt and Steve for setting this up and such a wonderful location. I'm here on behalf of about 35 of my colleagues who are stuck in a dark room and have been gathering data and analyzing as the exchanges have gone live. They allowed me to go to sleep last night with the view that said, do justice to presenting some of the facts that we're finding. So I'll try to do that in the next 10 or 15 minutes here. So a few things just as we go into this. First, just what are the facts that we have? What are the facts that we have pulled up? We've built a database across 46 states and DC. This is where the data has been available. It is an evolving data set, evolving in the sense of that this is as of October 9th, and we are finding every day that we find new plans and new pricing kind of emerge in some of the instances as the data kind of sorts itself out and cleans up. So again, I do want to set this as it's in October 9th, and literally on a daily basis, the data is evolving as the exchanges come online further. What we have been able to gather is a lot of the pricing data, product data on the networks, carrier details, some of the details on cost sharing, as well as marry it up with about 150,000 consumer data points that we've been able to gather. And this has happened over the last many months that we've gathered to kind of understand the consumers that are likely to be shopping on these exchanges, how they are likely to react to these prices, so we can understand a bit on what may happen as the choices are placed to them. So that's a bit about the data set. So what have we found? 4 things that we have found at this point. 1, the competitive intensity varies quite significantly across the markets. And there is very wide variation, and I'll show you a bit of that in a bit. The second part within there is that new entrants are actually pretty meaningful part of the competitive landscape. So a lot of new carriers have entered the market. Second, that when we look at the pricing, carriers are creating value, or at least creating value products through a bunch of changes that they have made. So we'll talk a bit about that, particularly around networks. One of the interesting phenomena in the way the subsidies work is the availability of essentially zero premium products. So I'll show you a bit of data on that there are people at certain income bands that will actually have options of zero income products. And then as we look at this, there is likely to be market movements that happen as a lot of the volume is expected to flow to some of the price leaders. So let me go to this map of the country, which shows just the competitive intensity. The shadings represent how many different types of carriers are there in each market. This varies from 1 in New Hampshire to 16 in New York, so that's kind of the full range. If you look at it, there are 35 states where we have new entrants, at least 1 new entrant in the marketplace. So there's a fair diversity, if you will, of the competitiveness of the various markets around the country. So we looked, if you look at how many carriers are in there, and I should just describe this, we've counted this as insurance entities. So a particular carrier in a particular state, and if they're HMO entity, we've counted it by entity. A third of the incumbent carriers in the individual market have chosen not to participate on exchanges. So we had 299 to 200. 80 new entrants have emerged across these 35 states that I mentioned. A lot of them are co-ops, previously Medicaid players, or not previously, but they're Medicaid players who didn't play in individual or commercial, and provider-owned plans. Those are kind of the major ones within these new entrants. If you counted this by parent entity, so not just by insurance entity, but by parent ownership, you would have 58% of people playing on the exchange are new entrants. So new entrants, many of them are smaller, just by definition, with the incumbents having many more insurance entities in many more states. If you take the largest kind of national players that have been in the market, most of them are participating. There is some, they aren't all participating broadly across the various markets and have picked markets to play in, but they are all on the exchanges in one place or the other. Now, if we look at what is going on in terms of the pricing and the value creation, so we looked at a lot of the rate filings, getting into the details of the rate filings. First of all, I'd say what the biggest elements in here are the trend, the morbidity, which is the risk, what the risk pool will look like, what they've estimated, the benefits, the essential benefits, et cetera, that the ACA requires. Those, of course, are up arrows. What I would say is on morbidity, there's a lot of variability that we see. The big part here is that on network, so actually using network to lower the prices, we see a lot of significant movement that carriers have made on that, to the extent that we've seen 24, 25% network efficiency factors kind of changing the economics there. Now, a fair bit of this is also compared to the pre-reform market. We see many more managed care products. A lot of HMO products, a lot of EPO, so many more managed care, more restrictive products being offered, and those are generally the ones that have the lower prices. So what you have is there is choice available for people in these markets across a range of product types, but there's a price differential that exists, and it'll be interesting to see how consumers make the trade-offs and choices essentially over how restrictive the network and the product is and the relative price that they're willing to trade off for that. Now, what we find on the new entrants is a greater use of HMO networks and the like. The co-ops generally have used PPOs. The others, as you would imagine, with provider-owned and Medicaid plans have used mainly HMOs and EPOs in their products. Now, in terms of where the pricing has ended up, so these are for the new entrants in the market. What the chart shows is how many instances are there where they are priced above the median price in the market, and we've taken a silver plan here, and how many are below. And what you basically see on the new entrants is two things. One, a majority of them are priced above the median. So while they are attackers, they are not attackers in the sense of just kind of being the lowest price player everywhere. On the other hand, there's a reasonable number of them that are actually priced below the median and therefore will be fairly competitive in these markets as they play out. So the effect of new entrants and competition will be an interesting one to watch, as there are a meaningful number of markets, at least, where they have come in below the median price. This is the other phenomena that is kind of mentioning earlier, is the presence of zero premium products. So what you've got here is the bronze and the silver, the age bands on the x-axis, and the income level, the percent of federal poverty limit on the y-axis. And what you see is at the low income levels, you actually get a number of people, and the numbers there are percentages, who, so for example, if you are a 60-year-old at 139% of federal poverty limit, 100% of people have access to a zero premium bronze. Now, the important part in this, of course, is that bronze doesn't have the cost-sharing subsidies, so the silver is important to the extent people want to access the cost-sharing subsidies when they buy these products. But in essence, free products will be available to millions of people at the lower income bands. And then the final thought that I'd leave you with is, I think many of you have seen this before in Massachusetts. It was clear that a lot of the volume flowed to price. And we are seeing real price variability on all of these exchanges. And the simulations that we have done would actually show, and I've just picked 2 states here. The simulations actually show that is, from a consumer standpoint, indeed true that we are likely to see pretty meaningful movements happening. Now, as I showed earlier, there's no pattern that attackers have a lower price or the incumbents have a lower price. And so it will move in all directions. It's not like the market disruption will go in one way, but there will be a fair amount of market disruption that we should, we're likely to see as consumers make their choices in these marketplaces. So thank you. Hopefully some of these facts are helpful to setting up the dialogue for today. And like I said, this is an evolving data set and a database, and clearly an evolving marketplace. And we are certainly continuing to watch this very closely and track it as we go along. Thank you.